Hey guys, I want to talk to you about a temporary handicap parking placard. Some states call it a handicap parking permit that you might want to consider getting prior to having your rotator cuff repair surgery. So if you don't know me, my name's Tony Maritato. I'm a licensed physical therapist. I treat patients following total knee replacement and rotator cuff repair surgeries. And one of the topics that came up recently was, should I get a placard that allows me to park in handicapped spaces? So following surgery, you are not going to be the driver. But even if you're not, if you're driving your vehicle, and different states have different regulations, but I would encourage you to consider applying for a temporary handicap parking placard before you have your rotator cuff repair, because following surgery, you're going to be driven to outpatient physical therapy. Depending on where you go, there are some clinics that you might have to park as far as a quarter mile away from the actual therapy center if you don't have a handicap parking placard. So they're usually either free or very inexpensive, $5, $10, $15. The doctor, whether it's the surgeon or your physical therapist, somebody is going to have to provide some medical information regarding what is the procedure you're having, what is the expected duration you'll need the temporary parking placard. I can tell you that most rotator cuff plans of care are going to run about 12 weeks. That doesn't mean that you can't drive for 12 weeks. That just means that I would maximize the duration that I have the placard, so that if I'm driving at 6 weeks and I decide I don't need to use it anymore, I just don't use it. I don't put it out. I put it away. I get rid of it. But the idea is, it's better to have it and choose not to use it because you don't need it than it is not to have it and wish that you did. So most patients are driving by 6 weeks. They're out of the sling and they're back to independent driving and using the upper extremity more than they were. But the bottom line is, whoever is giving you the ride, whoever's providing you with the transportation, we want to make it as easy on them as possible to get you to your destination and make sure that you have a positive experience with this. So certainly consider a temporary handicap parking placard. Research it for your state. Go to your state's DMV website. I've also posted some articles that might help you to understand what kind of medical information you're going to need and how to go about the process of applying. But you would want to apply hopefully 4 to 6 weeks before you have your surgery, so that you give the DMV more than enough time to issue the parking permit. Guys, if you have other questions like that, absolutely let me know. Post them down in the comments and I'll catch you on the next video.